By the looks of things this morning, the commuters were back. Less than 24 hours after the work-from-home guidance changed, people appeared to be flocking into the office. In schools, too, children were allowed to take off their masks. These, though, didn't feel comfortable just yet.
If wearing masks is the precautions we need to take in order to protect our community, then that's what we must do.
With our GCSEs coming up so quickly in just a few months, it's really crucial that everyone's in school and in lessons, not only the students but the teachers also.
From next Thursday, though, even more restrictions will be lifted. Face coverings in all settings will be scrapped. Large venues will no longer require COVID passes, and the self-isolation rules are expected to be lifted by the 24th of March.
We've started to see in the data the case numbers are falling, hospitalisations are falling or stabilised in other parts of the country, infections are falling, and that allows us to take the measures that we announced yesterday.
But demand on hospitals is still high. More than 93% of beds are occupied in England. This community hospital in northwest London helps to free up beds by admitting patients who aren't quite ready to be discharged. But it can only do so much.
We're not there as a replacement for what's happening in A&E departments. We can relieve some of the pressures in terms of easing the bed numbers for a particular cohort of patients who would benefit from being here. But if people are sort of going into A&E in their droves, then obviously the pressures will build up there and people will have to wait.
And have they talked about you going home yet?
Not as yet.
James has seen the problems up close. The police had to take him to hospital after he broke his hip because the wait for an ambulance was so long. Then COVID set his rehabilitation back weeks.
I ended up getting COVID because somebody came in with it, and I had a couple of weeks here in isolation.
As restrictions finally do ease, hospitals are braced for another period of uncertainty. They hope demand won't increase, but nobody knows for sure. Emily Morgan, ITV News.